Hi, I'd like to share some tips and tricks to help you get the most out of using Smileyscope. If you're new to Smileyscope, please check out our 3-minute how to use video. It's best if patients are well prepared before they arrive for their procedure. Visit Smileyscope.com for lots of great online resources such as our preparation video, which explains the medical procedure and how Smileyscope virtual reality can help with their experience. Before the procedure has even started, you can help patients to look forward to their procedure. You can use your website, social media, or reception staff to let your patients know that you are dedicated to creating the best possible experiences with Smileyscope. You can put a Smileyscope poster in your waiting room. When the patient arrives, the receptionist can remind the patient about Smileyscope. You can do this in a variety of ways. Some practices ask about needle fear, others get their receptionist to ask whether patients are interested in going on a great underwater adventure in their procedure. Some practices find that patients want to try Smileyscope before their procedure. They can watch the preparation video or try out the virtual reality experiences while they're waiting. Some clinics find it useful to put a note in the patient's file so that the clinician knows that they want to use Smileyscope. This helps the proceduralist save time and get started straight away. Using local anaesthetic can reduce the physical sensation of pain and works really well in conjunction with Smileyscope. When it's time for the patient to come into the procedure area, it's a good idea to try to engage them in the idea of going on an exciting underwater adventure. You can set them a goal to focus on, like your mission is to find your favourite animal or catch 5 clownfish. You want to make sure the patient feels safe and is in a comfortable position. For older patients, the caregiver may sit next to them and give them a hug. For younger patients, the caregiver can support them by being the submarine and seatbelt and ask them what they're seeing on their underwater adventure. Patients may be able to wear glasses with the VR headset. Simply put the headset on their face first and then adjust the headband. Ensure the patient is in a position which will be comfortable for the duration of the procedure when you triple-click to start. This position determines the direction of the fish in the virtual reality world. One of the unique things about Smileyscope is the way it reframes scary sensations in the virtual world. Explain to the patient that they may have a diving band hug their arm and waves washing over their arms while you clean their skin. The audio guides you through the procedure. You can listen to the audio prompts and hear when they've caught a fish or an octopus. When the captain says, "If you look at the fish, they might come in and say hello," that's the time to insert the needle. Some children like to know when they're having a needle, and you can tell the child at this point. You can continue to engage the child by saying something like, "Can you imagine the fish coming in and having a quick nibble?" Your job is to keep very still and describe your favourite fish. You're letting the patient know they'll still have the procedure, but they can imagine it differently and focus on the virtual reality experience. Don't worry too much about getting it exactly in sync. You can tell the patient that they may feel extra waves wash when you are cleaning the procedure site or fish nibble when you insert the needle. We encourage you to continue engaging with the patient while the experience is running. The headset has a pivot mechanism so the patient can have a peek if they want and then return to the virtual world. This pivot also enables better fit with a gas mask if required. If the procedure takes longer than expected, the virtual reality experience will continue to loop. To better understand how your patient experiences Smileyscope, we suggest you have a go at the device too. This will also help you time the procedure. Clinicians who use Smileyscope regularly say that it's a much better experience for patients and caregivers while making their job faster and easier. We hope you do too. Thanks for watching and enjoy using Smileyscope.